John asks, I would like more instruction on how I can dissolve a kidney stone stuck in my bladder. It's making my life miserable now. Well, John, this is a frequent occurrence for a lot of my patients, and I can totally understand that it is not just frustrating, but it's extremely painful. Some of the kidney stone patients have described passing a kidney stone to be even more painful than natural childbirth. So I want to recommend 5 different steps for you to help resolve and dissolve the kidney stones. First, I want to kind of lay down some foundational aspects about kidney stones. Not all kidney stones are the same. 80% are going to be a particular type of stone that's easily dissolvable. And then others might be crystallizations or mineralizations that we can address by changing diet and lifestyle, and even some medication influences as well. So knowing that I don't know anything about your history, I'm just going to give you a broad kind of scope of how I recommend for a lot of my patients to resolve their kidney stones. First of all, one of the most important things, apart from what you probably hear about consuming a ton of cranberry juice, I recommend not doing that. I recommend consuming in a lemon infused water. And when I say lemon infused water, you want to make a daily batch of about 64 ounces of water infused with 3 to 4 lemons, juice of lemons. Some of my patients will brew that up. They'll release the properties from the rind, or they might use a juicer and add in water. However you do that, but you just want to consume lemon juice water throughout the whole day. Now, being mindful of your dental health, you want to make sure that after you consume, 6 or 8 ounces, that you rinse your mouth out because it's highly acidic to our enamel. Lemon water has been proven to be highly potent at dissolving some of the early stages of the formation of kidney stones. Now, again, it depends on what type of form, but we also see this as a preventative aspect. So lemon water in your diet and even consuming lemon water in the morning can be highly potent. My second recommendation is a very unknown but amazing herb called Chianca piedra. And this is a fantastic herb. We know it as stonebreaker. So this herb actually grows all over the world, but it has the amazing capacity to help dissolve some of the different stones depending on their formation. And even for the really tough crystallized stones, it'll smooth the edges. So literally, I have patients that have scans and they'll have a 1 to 3 millimeter stone. Sometimes they have even larger stones. It's painful for me to think about it because passing a large stone is going to be extremely problemsome to the whole entire urinary tract, but it also not only is painful, but really is limiting in terms of your capacity to live your life freely. And one of the things that we see is Chianca piedra has been heavily researched in its capacity to dissolve and break up stones. Sometimes it can break up anywhere from 25% to 95% of the stone. And what it does in that dissolving process, it makes it like the sediment. So when the urine flow is happening, instead of passing a stone, it might be a little bit of sediment that is pain-free in its flushing. Now, my third recommendation, because there are usually there's more than one. So the likelihood, if you have had one kidney stone and you're in the process of passing it, the likelihood is you probably have a few more in there, or you will develop them within a year to 3 years after the first occurrence. So once the cycle begins, it becomes hard to break. One of the things that occurs because of the stone's presence is a great amount of inflammation to the kidney itself, and then the whole entire urine, the urethra, the bladder, the whole entire urinary tract gets inflamed because the stone is jagged. And when we scope these stones, they look horrifying. They look like natural crystals that people mine for. We don't want that in our kidney. So what we're dealing with when they're passing through, they cause inflammation and they can even cause scarring, especially if it's a repeated process. So reducing inflammation is really critical. One of my favorite products here at Organixx is the turmeric 3D. This is a super anti-inflammatory, and it also can aid in sometimes reducing the pain that you're experiencing. Now, my other recommendation, if you haven't done this before, and a lot of people don't, and it's crazy, I hear sometimes urologists don't make this recommendation. When you pass the stone, make sure you retrieve it and we collect it. I know that sounds kind of icky, but it's really important for us to analyze, to have your urologist pathology the type of stone that you are passing, that your body's creating. If we can determine what type of stone is being formed by your body, then we are more equipped with knowledge to be able to maybe make a dietary change, or to maybe look at a medication change, or to add in Chancapiedrate and lemon water to your daily mix to absolutely prevent these from happening moving forward. And my last and final, my fifth recommendation is to add in a micronutrient panel into the mix. Maybe it's with your urologist or a functional medicine provider like myself, where we can look at your mineral intake, where we can look at your body's mineralization practices, but also look at your mineral levels. It's not uncommon where individuals' bodies are rearticulating excess calcium into the kidneys. And so it might be a situation where maybe we need a little vitamin K2 to offset and enhance the absorption of calcium. Sometimes it might be we have not enough zinc, or maybe we have too much magnesium, or whatever the imbalance might be. We need to determine that and test that. But my recommendation, John, is hang in there. Do know that there are things that you can do right now to help resolve and dissolve the stone. When a stone is in the bladder, that passing, it could be anywhere from a day to months. I have some of my patients, they're in kind of a monitoring zone, and we've been able to reduce the size of those stones. So even they're passing, they're like, I think I passed what used to be a really large stone, and sure enough, completely resolved. So I look forward to hearing some positive results, and I'm hoping that you'll stay in touch with us and let us know how these recommendations turn out for you.